Thank you everyone for joining us today. I'm excited to be talking with you about HR trends. And while we will certainly touch on COVID-19, it will be nice to talk about something other than COVID-19 as well. My name is Lori, and I am the HR Consulting Manager here at Eide Bailly. I've been with the firm for 17 years and have been in the human resources field for 30 years now, and really enjoy helping our clients with any HR needs that they have. So that's the role that I play here at Eide Bailly, and I'm looking forward to talking with you today about HR legal trends. All right, so the things that we're going to touch on today, I would be remiss if I did not talk about COVID-19, so we will touch on that. And then I'm going to talk about some other things that employers really do need to be paying attention to as it relates to employment law. So we'll talk about paid leave. We'll talk about the Fair Labor Standards Act, which covers minimum wage and overtime. We'll discuss reasonable accommodations under the Americans with Disabilities Act. I'm going to touch on pay equity, as that is a really hot topic as well. And then we'll wrap it up with the Affordable Care Act. Now, some of these elements kind of dovetail into COVID-19. Some of them don't, but definitely wanted to cover some of the things that we are seeing that employers really should keep on their radar. So let's start with COVID-19. The things I want to talk about today are all things that are related to human resources. So it's nothing related to payroll or to any of the tax resources that are available to employers. It's specific to the human resource element with regards to COVID-19. So we're going to talk about the Families First Coronavirus Response Act, otherwise known as FCRA. We'll talk about changes to unemployment and the unemployment insurance that laid off or furloughed individuals are eligible for, because it has changed. We'll talk about essential workers in the workplace and what employer requirements and actually what some employer rights are in the workplace. I'll talk about staff reduction considerations in case you are in a situation where you need to consider reducing the number of staff that you have based on workload now. And then also touch on reopening and what those initial steps are. So with FCRA, this is a regulation that came out and was in effect from April 1st through December 31st as of now, and it applies to employers with fewer than 500 employees. And in the count of employees, you have to include your full-time, your part-time, your temporary employees, any staffing agency employees or employees on leave of absence, as well as PEO employees that you might have when you come up with that total as to whether or not you have fewer than 500 employees. And this act applies only if eligible employees are unable to work. So if you currently have telework situations where people can complete their job remotely or from home, then this does not apply to those folks. This is truly for the individuals who are unable to work due to the coronavirus for any of the following reasons. So if a federal, state, or local quarantine or isolation order has rendered your business needs to shut down and there is no way for your employees to work, then FCRA could apply. It also applies for individuals who have been advised by a doctor to self-quarantine. For example, if they happen to have come in contact with somebody who has the coronavirus and they have been told by a doctor that they need to self-quarantine. It applies to individuals who actually have coronavirus symptoms and are seeking medical diagnosis, or if somebody is caring for an individual who is in a quarantine. It also applies to individuals who are caring for a child whose school or place of care is closed. And it applies to individuals who are experiencing any other similar condition to COVID-19. So if they're showing the symptoms, they've got the fever, they've got the cough, they've got the sore throat, and the body aches, then FCRA does apply. Now, as I mentioned, this is only for employers who have fewer than 500 employees, which I would assume a majority of the folks on this call that applies to. And what it does is it provides employees with up to 2 weeks or 80 hours of what we call emergency paid sick leave. So it's their full pay, or if they're part-time, it's whatever their normal pay would be for any of the situations in 1, 2, or 3 in the list above, and 2/3 pay for situations number 4 and 6. And there are daily maximums. All right. Now, if somebody is unable to work because they have a child whose school or daycare is closed, those individuals get an additional 10 weeks of time off under what we are calling the Emergency Family Medical Leave Expansion. And that, again, they continue to be paid 2/3 of their pay if they're having to stay home and care for a child. Now, one thing to keep in mind, and thank gosh they came out with an update a couple of weeks ago because a lot of folks had questions about this. Situation number 5, which provides that expanded paid sick leave, is only an option for employees who are caring for children under the age of 14. So if somebody is saying that, no, I can't come to work because my high school age child doesn't have school and I need to be there to make sure that he gets his schoolwork done, well, that doesn't apply unless that individual has a specific need. So if they're on a learning plan, or if they have some sort of disability and they cannot care for themselves and they're over the age of 14, they would have to put in writing why their child over the age of 14 would qualify for them to get that type of additional leave. In addition, they had something in the original act that stated that smaller employers under 50, can claim an exemption from that paid leave for individuals who have to care for their child who doesn't have school or daycare. But they didn't say how to apply for that exemption, and they didn't say who would qualify for that exemption. Well, the clarification that they came out with was that what you have to do is document if providing that leave would place the business in jeopardy. So if you have a key individual, there's only one of them in your organization, they have the ability to work from home, but they're saying they cannot because they have to care for a child, and you're saying, we need that person. Like our business will take a severe hit if that individual is gone for those full 12 weeks. You can document that you need an exemption from it. You can require that employee to work, and if they're not working, you can lay them off, as long as you have it documented as to why. And I want to make sure you understand that that documentation needs to be put in place at the time you make the decision, and it needs to include some significant factual data. So what type of financial impact would it have? What kind of impact would it have on the organization from a customer service perspective, or from an ability for you to even get your job done, or for your organization to get the job done? You need to document it clearly if you are filing for the exemption. The thing with FCRA is that you either need to do FCRA, or if you have applied for PPP and are following the route of PPP, then FCRA does not apply. You either do one or the other. And I am not an expert on PPP, but if you're one of the folks who did apply for it and you received it, then FCRA does not apply to you. The other thing that changed with coronavirus is unemployment, and the federal government gave a lot of power to the states with regards to unemployment. States are given the option to do a number of things that they normally have not been able to do previously. One of the first things it did is it allowed states the option of providing unemployment to workers who typically don't get unemployment. So those would be contractors or the self-employed. They're allowing those individuals to file for unemployment and receive it. It also allows states to extend unemployment benefits by up to 13 weeks under what they are calling the Pandemic Emergency Unemployment Compensation Program. So most states have adopted this to allow individuals to collect unemployment for an additional 13 weeks beyond what they normally would. And the last thing that has been an effect to unemployment is that due to COVID-19, the federal government has allowed states to choose to implement the federal pandemic unemployment compensation to provide an additional $600 per week to individuals who are collecting regular unemployment compensation. So make sure that you check with your state unemployment site to see what options are available in your state, so that you're aware of what type of unemployment compensation your employees could receive in the event that you do have to lay them off, terminate them, or render them as furloughed, which we will talk about here soon. Many of us do have the ability to continue working, and some individuals will be able to work in their office spaces. Other people will have to work from home, but that the concept of work continuing just identifies that some individuals are considered to be essential in their roles. And if they're essential in their roles and they have to come into the office, you as an employer have some requirements that you need to meet, but there's also some things you should be aware of. And we're going to talk about both of those things. The first thing that you need to keep in mind is that if someone says that they have coronavirus, you should not ask them for a doctor's note to prove it. The doctors have a lot going on right now. They do not have time to write notes for every single individual that they might interact with. And not only that, but with testing being as difficult as it is to get, it would be hard to actually prove that many people have it, even though they are showing all of the symptoms of it. So the CDC has actually come out and said, hey, employers, please don't require a doctor's note if somebody says they have the coronavirus. And you're just going to have to kind of go on the honor system with your employees and hope that those who are telling you that they have it actually do have it, but just treat it as though they do and follow the proper guidelines. The other thing to keep in mind is that if somebody has COVID-19, they may qualify for FMLA or short-term disability based on what your eligibility requirements. So if you are an employer over 50 employees, then FMLA is a requirement for you. And if you have an employee who gets the coronavirus and is sick for an extended period of time, you may want to put them on FMLA. So just so you can track the time that they're off and count it against their FMLA. So keep that in mind. And if you are an employer of over 50 employees, you'll want to make sure that you're following the standard process for FMLA leaves, because this would be considered a medical leave. If you are an employee that offers short-term disability to your employees, then somebody who is infected with coronavirus may be eligible for short-term disability leave. So follow those policies as well. With regards to those types of situations, doctor's notes would be required because most short-term disability insurance companies require a medical certification in order for them to pay out that short-term disability. And for FMLA, there are legal requirements for obtaining medical certification in order for somebody to go on to FMLA. So in those two circumstances, if somebody's leave is extending beyond just a few days and FMLA or short-term disability apply, you will want the employee to get a doctor's note. The other thing to keep in mind is while you may think that people have to be in your office, one of the things that you need to operate under is the understanding that if you tell someone, hey, your job, we need for you to be in the office, so you need to come into the office, and you have to be here, you can't just work from home. If they get the coronavirus while they're working, or if they even think that they got the coronavirus because they had to come into work, they may be eligible for workers' compensation. And I was on a fantastic webinar last week with regards to COVID-19 and workers' comp. And the flat out line that they said was that if an employee comes to you and says, hey, I've got coronavirus and I got it because I was here at work, immediately file the claim. Let your workers' comp provider determine if the employee qualifies for workers' comp or not. And some of the things that we talk about here in a minute, you'll want to document all of the things that you're doing to make sure the work environment is safe for employees. And as long as you have it documented, if an employee files for that unemployment or for that workers' compensation, you can then tell the workers' comp provider, hey, here are all of the things that we put in place to make sure people don't get it here at work. So if they're saying that they do, the worker comp provider takes those factors into consideration when determining if they will be granted workers' comp or not. And then the last thing, something that is new, and this likely was a violation of HIPAA prior to COVID-19, but now that we have this going on here in our world, employers can now require employees to take their temperature to prove that they're fever-free before coming into the workplace to work. So if you have people coming into work and you want to make sure that you're providing a safe work environment for all of the other folks who are coming into work, you can require all employees to prove that their temperature is below fever level, so that you're not letting individuals into work who may be carrying the virus. All right, so what I want to talk about now is, if you are fortunate enough to be able to continue operations, there are some things that you as an employer should be doing during this crazy time. The first thing you should do is make sure that you're following the jurisdictions and building regulations. And what I mean by that is, some states are allowing different types of employers to open up earlier than others, but some require that everybody wear masks or that people wear gloves, although that's going to the wayside because people don't seem to know how to use the gloves properly. But wearing masks or having hand sanitizer or having Clorox wipes or things available for common areas. You want to make sure that if you are offering people the ability to work in your office, that you are following your state, your city, your county requirements and are adhering to those. And not only that, but if you are a tenant in a building, you want to follow up with either your property manager or your landlord to find out if there are building regulations, because you want to make sure that if your employees are interacting with employees of other businesses within your same building space, that everybody is putting into place the proper safety protocols to ensure that the COVID-19 doesn't spread. The other thing that we are seeing is that employers are finding circumstances where they now need to handle performance issues that they may have been letting go in the past. And that is perfectly acceptable. I think a lot of employers are finding that, wow, they might need to lay some folks off and they're going to lay this person off because they're not a good performer. Well, unfortunately, if you didn't document it very well previously, it could put you in a risky situation where if you terminate somebody and they were unaware that they had performance issues, or you didn't have those performance issues documented, that it could cause some problems for you down the road with them trying to sue you for wrongful discharge. So now is the time to start handling performance issues if you have not been handling them in the past. And it is okay to be very transparent with your employees to say, hey, we're having to run a tight ship now, right? Business has slowed down. We don't have the workload. We're not getting as many customers coming to us, or we can't provide the services that we normally provide. So we're overstaffed, and we are going to be handling performance issues. The second you have an issue, document it. Talk with the employee, put them on the right path to performing, or let them know that if they can't perform, they will be terminated. You really need to make sure that you're handling those performance issues now more than ever. And like I said, I've had a number of clients who are in a situation where they want to terminate people because they're overstaffed, but there is no documentation on poor performance. So they're having to kind of start the clock over. And now when they see performance issues, they're dealing with it so that they can eventually move to termination if the employee can't improve. The next thing that you need to keep in mind is that it is your responsibility to provide a safe work environment. And right now with social distancing, what that means is you need to have a skeleton crew in the office, or you need to set up shifts for people to come in so that you don't have all of your employees in at the same time. And if you do need to have all of the employees in at the same time, you need to distance them. You should be doing a number of different things, which we'll get to here shortly, but some of them include, removing half of the conference room chairs, or removing half of the chairs from the break room, having cleaning supplies handy for common areas like the break room, the coffee pot, the refrigerator, making sure that people know that, hey, if you are getting something out of the fridge, once you get it out, you need to grab a Clorox wipe and wipe everything down and throw it away and move on. If they need to wear masks, make sure that they are wearing masks. And if you can find masks and provide them, that would even be better. but it is your responsibility to provide a safe work environment. And what they are saying now is that if at all possible, let people work from home. If their job is one that they can do remotely, let them work from home, because that is the safest place for them to be right now. The other thing that is an employer's responsibility is to just communicate with employees and do this on a regular basis. It could just be every week or every 2 weeks, you get together with everybody via Zoom or via team meetings or via conference call to just touch base and see how everybody's doing, to let them know about different benefits that you might have that can help them deal with what's going on, whether that's teledoc or the employee assistance program. Let them know if you're having to cut costs, hey, we're in tight times right now, so we're having to cut costs. So here are different things that we're considering, or here are the different things that we're doing to cut costs. But keep them in the loop so that they are aware of what is going on. And then last but not least is manage that physical, social, and mental health and provide those resources for employees. Like I mentioned, if your health plan or if your life insurance plan has an employee assistance program attached to it, which most do, or if your health plan offers teledoc or virtual or doctor on demand, any type of service where an employee doesn't have to go to a doctor's office, they can actually call in or video into a doctor and talk about whatever health situation they might have. Offer those options to them. Employees will completely forget that they have those types of resources available, and you need to remind them. And then with regards to their social and mental health, a lot of people utilize work as their social platform, right? It's where they interact with people. It's where it's part of the joy of working is that they get to interact with other people. And with individuals working from home, it makes it kind of tough. And I know that everybody's utilizing Zoom for meetings. They're utilizing Zoom for happy hours. They can use Teams through Microsoft for the same types of things. Set up regular social interactions for individuals so that they can see one another. They can see their coworkers. They can talk with one another. So instead of calling or emailing somebody, set up a Zoom meeting so that you can have that face-to-face interaction and allow people to do the water cooler talk via video conferencing. I think we're all learning that there's a whole lot that we can do working remotely that we never thought would be possible before. So helping your employees to manage that physical, social, and mental health really is going to go a long ways. If you do have to reduce staff, there are 3 different routes that you can go. You can either reduce employees' hours, and if you reduce their hours by enough, they may be eligible to collect unemployment insurance. By reducing their hours, of course, you're saving costs with regards to their compensation, but be sure that before you reduce hours, you check with your state unemployment agency to find out how far below a normal level of work they have to be before they can collect unemployment, because you don't just want to cut their hours without taking that into consideration. When somebody is on reduced hours, they may be able to keep their benefits, so any health, vision, dental insurance. Most of the providers are being very, very flexible about allowing employers the opportunity to provide group benefits, even if an employee moves below the normal threshold or eligibility requirement. But you will want to make sure that you contact each of your benefit providers just to confirm that. So if you're thinking about cutting hours, you're going to want to call your benefit providers and say, hey, we're cutting hours. We've got these 4 people who will now fall below the normal eligibility requirement, but we want to allow them the opportunity to stay on benefits. And they will let you know whether or not that's a possibility. Another option is to furlough employees, and we are seeing a lot of employers doing this. And what a furlough is a temporary suspension from work. It's almost like an unpaid leave of absence. And that truly is what you treat it like. The intent with a furlough is that you are going to temporarily have them suspended from work, and during that time, they do not perform any work. but they stay on as in your registry as an active employee, so you can continue benefits for them. They don't accrue things like PTO. They don't get paid for holidays or any of those types of things. But their access to your systems, their access to email is all cut off, because if they are furloughed, they are able to collect unemployment. And the second you mess around with having them even answer one question, now you have to pay them for the time that they actually worked, and that gets really messy with regards to unemployment. So our recommendation is that if you're going to furlough someone, cut off their access and then stay in touch with them to let them know, yes, we originally said the furlough date was going to be through the end of August. Each month, just touch base with them. Yep, it's still looking like the end of August. Or when you get closer, hey, it's looking like we need to keep you furloughed. Or at that time, you may determine that you can't continue to furlough. You do need to lay them off, which is the third option. And a layoff is a termination of employment. This is just like if they had resigned or you terminated them for cause. It is termination of employment. So they no longer are eligible for benefits. You treat them as though you would any other departing employee. So you continue their benefit coverage through COBRA. You offer them that option, but they cannot stay on your group plan as is, and their employment is terminated. So those are options with regards to what to do if you're needing to make some staff reduction choices. Something I want to talk about is reopening, because this seems to be the hot topic of COVID-19 now. We're talking about reopening, and we're in the initial phases of reopening in many states, and in some states we're just in the planning for it. So again, you want to make sure that if you are reopening your business, that you're following jurisdiction mandates. And some of the things you might want to make sure you consider before having employees return is you'll want to see a decline in the trend of new cases of COVID-19 over a 14-day period in your area. You will want to make sure that the number of positive tests that come in is less than a certain percentage, and you can determine what that percentage is that you're comfortable with. You'll want to make sure that hospital bed utilization in your state or area is below a certain percentage. And then with regards to your office specifics, again, follow your building mandates and what they're telling you. Make sure that you have enough of the personal protective equipment that is going to be necessary for employees to safely work around other people. So masks, the cleaning supplies, the hand sanitizers, antibacterial wipes. Make sure that you provide all of those at the common stations, and check with your janitorial services to make sure that cleaning is beefed up. You want to make sure that if you were on a once a week rotation for having your offices cleaned, that is done more frequently because you have people in your offices. You also want to take into account those who are considered high risk, or those who live with someone who is high risk, because those folks should likely not be coming back into the work environment. And you'll want to see if there are other options. And as I mentioned earlier, if people can work from home, allow them to work from home. And if you are reopening, what we're hearing is one of the better practices is to set up teams of people. And in this situation, I only have 2 teams. So you have team A, and they come into work and they work week 1. And then you have team B, and team B comes in on week 2. And team A employees never work at the same time as team B employees. So you're keeping similar groups of people together. So it could be X number of people from each department, or it could be an entire department comes in on team A, and then other departments come in on team B, or other individuals from various departments come in on team B, but you keep them from interacting with one another at all. So team A will never come in on a week that team B is working, and you continue rotating them. And that is one way that they're saying is a safe way to bring people back into the environment. But keep in mind, things are not going to get back to normal right away. As a matter of fact, I've quickly learned the old normal is gone. Our workforce will never look the way that it did. It's going to be very, very different, and it's going to take time. There are some businesses that they're saying will not open until January of 2021, which just boggles my mind, but the likelihood is we are not going to get back to our new normal right away. And it's scary. And some people handle it really, really well, and others don't. So just keep that in mind as you're making business decisions. All right, so things to watch out for with regards to COVID-19, stay up to date with the changing regulations, and it changes every week. And you just have to accept the fact that we're kind of in unprecedented times right now with a global pandemic. So there is no playbook. Just do the best you can to stay educated. I probably take part in 2 to 3 webinars on COVID-19 every single week, just to try and stay updated. And every week there's a change to what we learned before. So as an employer, it's your responsibility to stay up to date with those things. All right, stepping away from COVID-19, we're now going to talk about some other HR legal trends that we are seeing that employers need to kind of just keep on their radar. And the first one is paid leave. Now, most states do not require an employer to provide vacation time or holidays paid. The thing is, most employers do provide those benefits. So if an employer offers paid vacation, they have to follow their policy for the benefit. You have to have a policy in place that talks about accruals, when people receive their accruals, how much they, or how to utilize what they have accrued, whether they need to provide notice or get approval, those kinds of things, how they use the time off. If they're an exempt employee, are they required to use it in 4-hour increments? Do non-exempt employees have to use it in the minute-to-minute increments that they take paid time away? So you'll want to make sure that you create a policy and that you follow it. And then you need to check with your state regulations for paid leave to see if you can put a cap on accrued leave, to where you can say, hey, you know, you can accrue 1 year's accrual plus 40 hours. And then anything over that, you're just not going to accrue anymore. So make sure you use your paid time off. There are some states that do not allow you to put a cap on leave. They just allow employees to rack up all of the accrued leave that they want. You also want to check to see if your state allows a use it or lose it policy, where December 31st, if you don't use all of your PTO, you're going to lose it. You need to make sure that you check with your state to see if that type of a policy is an option for you. And as an employer who offers paid vacation or paid holidays, you need to stipulate in your policy whether an employee will be paid for either of those types of earned paid time off when they terminate their employment. So there are some states that say you don't have to pay it out at their termination, but the majority of states say you do have to pay out at least vacation. In almost all states, you don't have to pay out any holiday accruals that employees might have, because usually an employee has to be employed on the day of the holiday in order to receive the benefit. But you want to make sure your policy states that. All right, so with paid sick leave requirements, this is a completely separate topic. Paid sick leave is now something that a lot of states are requiring employers to provide. And there are a number of states, and I know when I looked at the roster of folks who were joining the call, we had individuals from California and Arizona, and both California and Arizona do have paid sick leave requirements for employers. More and more states are adopting this policy, and the accrual for how much paid sick leave an employee earns varies from state to state. In some states, it's every X number of hours worked, the employee gets this many hours of paid sick leave. In other states, it's you have to give them this many hours per year. So you want to make sure that you look at the paid sick leave policies for your state in order to see what the requirement is in your state. Those states that have a mandatory paid sick leave requirement, if you currently have a PTO benefit that combines vacation and sick leave, you may not be in a circumstance where you have to add sick leave onto your PTO. If your PTO benefit is generous or robust enough, it could meet the state's requirement. And so, for example, if you currently offer your employees 10 hours per month of PTO, which is 120 hours a year, and your state paid sick leave requirement is 40 hours of paid sick leave, well, your existing PTO benefit is generous enough that it covers the paid sick leave requirement plus allows some additional time for vacation. So that is a situation where you would likely not have to have a separate paid sick leave, okay? Now, if you're only allowing employees to accrue 1 week of PTO and your state leave requirement is 1 week of paid sick leave, you will have to have separate PTO and sick leave. And it's not saying that you have to keep your vacation time at 1 week and offer 1 week of paid sick leave. You could say, okay, fine, we're going to give you 2 days of vacation, and then the state required 1 week of paid sick leave. You don't have to continue on with your paid vacation unless it is a state requirement. Moving on, as part of the time off segment, I would not be doing you a service if I didn't talk about FMLA. And FMLA is the Family Medical Leave Act, of course, and it is for employers who have over 50 employees. They have to comply with FMLA requirements, and it basically is for an employee who has been employed by the company for 12 months and has worked at least 1,250 hours within that previous 12-month period. Those are the folks who actually are eligible for it. So if you have over 50 employees and you've got an employee who's been on your staff for 2 months and they come up with some sort of medical circumstance that requires them to take time away from work, FMLA does not apply to that person. They have to meet the eligibility requirement of 12 months and working 1,250 hours. And it's an and, it's not an or. What FMLA provides is 12 weeks of job protected time away for someone to take care of a new child, whether it's a birth, adoption, or a foster care child, to take care of a family member who has a serious health condition, or to take care of the employee's own serious health condition. And then FMLA also includes a component for military leave, but I did not go into that component here. With FMLA, the thing that is really, really important for employers to understand is there is paperwork that needs to be filed in order to document the leave as FMLA. And if you do not complete the proper paperwork in the right order, the employee may get more than 12 weeks of time off. So you want to make sure that that you document things appropriately. I always use the Department of Labor's forms. They keep them up to date. Whenever I have a client with an FMLA issue, I immediately go out to the dol.gov site and download the current form. The first notification is just a general notice about FMLA. So an employee comes to you and says, hey, I've got carpal tunnel surgery coming up. It's going to be 6 weeks, and I think I'm eligible for FMLA. You provide them with a general notice about FMLA so that they know what the requirements and the eligibility is for FMLA. Then you provide the employee with a notification that lets them know, hey, here's what you've told us. Now we need for you to go get a doctor's note saying that yes, you indeed are going to be gone for 6 weeks. Here's the time frame. Here's what it applies for. And yes, this should qualify as FMLA. And then once an employer gets that notification back, they then provide the employee with the notification, which is called a designation, that lets them know that their leave does qualify as FMLA and that the time frame that they're going to be gone based on the doctor's medical certification will count against their FMLA leave entitlement. So you want to make sure that you are doing those things if FMLA does actually apply. There are other types of leave as well. And as I stated before, with vacation, PTO, or holiday, you will want to make sure you have a policy for each and every one of these types of leave. Some of these leaves, it is required by the state that you pay for the time that the employee is gone. Jury duty, voting leave, and military leave. Some states require that an employer pays for a portion of the time away for those types of things. Other states just requires that you give time off to the employee to take care of jury duty. You know, you're required as an employer to hold their job for them to go do jury duty, but you don't have to pay them. For voting leave, there are some states that require that you provide employees with anywhere from 2 to 4 hours of paid time to go vote. And in other states, it just says that you have to provide employees with the time to go vote, and it can be unpaid. With voting leave, you can ask employees, if your standard hours are Monday through Friday, 8 to 5, there is plenty of time before work or after work for an employee to go hit the polls. So you can usually put in your policy, hey, we're going to allow you this time, but we're going to ask that you please try and take care of your voting before or after work in order to minimize disruption to the work environment. Bereavement leave is one that's different. There is no requirement that you pay employees for any type of bereavement leave. If you are going to offer that option to employees, you will want to make sure that you stipulate exactly who is covered for bereavement leave. Meaning, is it parents, children, siblings, grandchildren? Are you going to allow in-laws and step-parents or stepchildren? Be very, very clear. And also keep in mind that some circumstances may require a bit more time off. If a spouse, a child, a parent happens to pass away, you know, 2 days of bereavement is likely not going to cover it. So have a clause in your policy that states that an employee can contact you or utilize PTO if additional hours are needed, and just be prepared for that type of a circumstance. And then military leave, states have different policies. And as I mentioned earlier, a lot of military leave now falls under FMLA. So you'll want to make sure that if you are an employer over 50, that you're adhering to the military portion of FMLA. And if you're an employer under 50, make sure that you're adhering to those state and federal guidelines. So the things to watch for, every state varies, and it's gotten quite a bit out of control over the last several years, how different the states are operating. So just make sure you stay up to date on what is required in your specific state. All right, we're now going to talk about minimum wage. This falls under the Fair Labor Standards Act, and there is a new trend for states and cities to establish different minimum wages. And I'm going to use Minnesota as an example, because that is where I reside. The Minnesota state minimum wage is $9.86 an hour. Up in Duluth, it is also $9.86 an hour. In Minneapolis, the city of Minneapolis, the minimum wage is $11.25 an hour for large employers and $10.25 an hour for small employers. And employees who are under 20 years of age can earn 85% of the city minimum wage for the first 90 days of employment. And right next door to us in Wisconsin, the minimum wage is $7.25 an hour. So as you can see, minimum wage is no longer just minimum wage. You need to make sure that you know what your state, your city, your county minimum wage is, and that you are paying properly. The other thing to talk about is overtime, because different states also have different requirements of how overtime is paid. Most of us think that overtime is time and a half for any hours over 40 hours a week. However, there are requirements in other states, and I know a couple of you on the call, this will apply to you. In some states, you have to pay overtime for every hour over 8 hours per day. And then in another state, it's every hour over 48 hours per week. And in another state, it's double time for hours worked over 12 hours in one day, or for any hours worked over 8 hours on an employee's 7th consecutive day of work. Again, they make it very, very complicated, so you need to be aware of the overtime requirements for your city and state. And one of the things to watch for is we still have folks in government who want to increase that minimum wage to $15 an hour. Some states are doing a stair step up to it. Others are fighting it with all they have and haven't started doing the stair step, but you're going to want to make sure that you keep an eye out with regards to that and how that will affect who is exempt from overtime and what you need to pay those positions that you traditionally are paying exempt. You may need to move them to hourly. All right, so now we're going to talk about reasonable accommodation. And the definition of reasonable accommodation is a change or adjustment at work for a reason related to a medical condition. And it's typically associated with the Americans with Disabilities Act. All right, now reasonable accommodations can mean a whole bunch of different things. And it is not an employer's responsibility to try to figure out what a reasonable accommodation for someone is. It is the employee's responsibility to let the employer know what the reasonable accommodation is. And some of the accommodations, it could include, making existing facilities accessible to wheelchairs, accessible to somebody who might have, back pain or those kinds of things. You have to make facilities accessible. It also may mean job restructuring. Somebody who is unable to lift 50 pounds, maybe that's a part of their job that they only do, 2% of the time. So maybe you just shift those job responsibilities over to somebody else and you give the employee who's requiring the accommodation other responsibilities that don't require them to lift 50 pounds. It could mean moving an employee to part-time status or to a modified work schedule. It could mean providing time off for treatments or doctor's appointments, acquiring or modifying equipment. I know there for a while, those ergonomic keyboards were really popular, and then now we have special chairs or the backrests or stand-up workstations, those kinds of things. Changing testing materials or policies, and what we mean by that is maybe the reasonable accommodation is that it has to be in a different language, or there needs to be an interpreter, or that certain ways of testing an employee's capabilities of doing something need to be modified due to a learning disability or something of that nature. And then, of course, providing readers or interpreters. Right, so reasonable accommodation does take into consideration undue hardship for the employer. But what the government factors in as undue hardship is the nature and the cost of the accommodation. So if somebody comes in and says, well, yeah, I can do this job, but I need for you to change that particular machine, and it's going to be $14,000 to change it, and you're a small organization, that likely will be considered unreasonable. It does take into consideration the financial resources of the company as well, and the nature of the business, the size of the business, the structure, and the makeup of the business. So they take into consideration a lot of those factors. I will say that it is not easy for an employer to claim undue hardship. When an employee makes a request for reasonable accommodation, typically an employer does need to accommodate it. And the thing I want people to keep in mind is that most accommodations are extremely reasonable. And in doing some research, we found that 31% of reasonable accommodations cost nothing. 50% of them cost less than $50, and 88% cost less than $1,000. So I know whenever we do that reasonable accommodation and what's the undue hardship, employers are always, their first inclination is to say, oh my gosh, no, I'm not going to do this. But most of the accommodations that are requested are extremely reasonable. So as an employer, if somebody comes to you with a reasonable accommodation, you can require the employee to get a certification from a medical professional to detail what the accommodation is. And when an employee comes to you, no one outside of HR or whoever it is that you have handling the accommodation should be told any details regarding the employee's medical condition. The reason for the accommodation is irrelevant, right? The employee comes to a specific person and says, I need this accommodation. The proof is provided through a medical certification. That medical certification should not be shared with anyone. It is protected under HIPAA. The organization just needs to make the accommodation if it's reasonable and just let folks know, hey, we're adjusting this, and leave it at that. The thing to watch for with the Americans with Disabilities Act and accommodations is that there are a lot of discussions right now regarding providing accommodations for pregnancy, breastfeeding while in the workplace, accommodations for domestic violence that might be taking place with an employee, and also the use of service and support animals. So those things are coming down the pipe and are things that the ADA is considering including as part of reasonable accommodations. Next topic I want to talk about is pay equity. And pay equity laws prohibit any type of wage discrimination that is based on sex. Now, that being said, we all know you should not be paying men more than you pay women, or paying women more than you pay men just because they're women, right? It goes both ways. It should not be based on the gender of an individual. Employers can have pay differences that are based on things like a shift differential. So if this person is working this shift, they may be paid more because they're working the night shift. You can also pay more based on seniority or a merit system, otherwise known as performance or experience, right? And then the last one, you can pay difference based on quality and or quantity of production of goods. So if somebody is paid for the number of items that they produce or the quality of the items that they're producing, you can have differences in pay there. My apologies, the joys of working from home. We just had a fire truck go by, so I apologize. All right, the thing to watch for with pay equity is that many laws are being put into place in states that they're banning employers from asking candidates about their salary history, because what that is doing is it is preventing somebody who may have been paid less than they were supposed to just because of their gender, who wants to move into a new role with a new company. They don't carry the fact that they've been underpaid to the next job, right? What the laws are moving towards is, here's the job, here's what it pays, and I don't care what you were paid at your previous employer. This is what you're going to be paid here. So that if somebody who was making $30,000 a year somewhere while their male counterpart was making $50,000, when they go to a new employer and the employer says, hey, what are you currently making? And they say, oh, I'm making 30. The new employer can't say, oh, that's awesome, I'm going to save so much money, we're going to offer her 40,000 and that's going to be great, when the pay for the position itself should be 50,000, right? So there are a lot of pay equity laws out there now that are barring employers from asking candidates about their salary history to keep that inequity from continuing. The last thing I want to talk about is the Affordable Care Act. It also applies to employers with 50 or more employees, and it is a requirement that employers offer health insurance that provides minimum value to 95% of full-time employees. And what they mean by minimum value is it has to offer some of those preventative type services. It is a health benefit that actually offers good services to the employees who are receiving the benefit. And the Affordable Care Act states that the health insurance has to be affordable. And for 2020, they consider affordable to be anything less than 9.78% of an employee's income. So the insurance premiums that an employer requires the employee to pay cannot exceed 9.78% of their income. When we talk about that minimum value to 95% of the employees, there are a lot of high deductible health plans that do qualify for that. And high deductible health plans have those lower monthly premiums, but they have increased out of pocket or higher deductibles for the employee. So it costs them less per month, but if the employee actually has to use it, then it may cost them more out of pocket. The thing that's great about the Affordable Care Act is that they are making that requirement that the coverage has some value to it. So if somebody who's on a high deductible plan is on that plan, they can go get preventative type services that are covered for the most part, and there are minimal out-of-pocket expenses. It's when something drastic happens and they need to use like the emergency room, or they get some sort of sickness that they need to have taken care of. That's what's going to cost. The employers can offer a high deductible health plan to meet Affordable Care Act requirements, and they can also have another more robust plan for employees to choose from. So something that might cost more per month, but cost less when you actually go to the doctor. If they want to do that, they can have both, but they have to offer an Affordable Care Act type of a plan. And the thing to watch for is that there will be more changes to ACA requirements. The ACA requirements change. Healthcare in general is changing. So just be careful and watch out for those types of requirements. That was actually all that I had, so it was perfect timing. I'm looking through some of the questions, and I will try and answer as many of these as I can. So can I clarify, employers aren't subject to FCRA if they receive PPP? I am not a PPP expert. What I have heard in the webinars that I am on is it is one or the other, but you would definitely want to talk with your tax professional about that to make sure. Please do not take my word for that. I am only the FCRA girl. Can an employer suspend PTO accruals when an employee is off for family leave? If you have in your policy manual that if someone is on unpaid leave, they do not accrue additional paid time off, then yes, you can. And that is very likely. So very common. So if you have an employee who is going on FMLA or any other type of unpaid leave, if you're an employer under 50 employees and don't have FMLA, if you have employees utilizing any type of unpaid leave, you can say that while you're on unpaid leave, you are not going to accrue additional paid time off. The other thing you can tell them is that before an employee can go on an unpaid leave of absence, they have to use all of their PTO, right? Check with your state laws to make sure that you can have that requirement, but I do see that quite a bit. And I encourage employers to at least have some sort of mechanism in place where they're telling their employees you have to use all but 40 hours of your PTO if you're going on a leave. And the only reason I leave the 40 hours is I think of individuals who do go on a maternity leave and they may want to have some PTO for when they come back because you know that they are going to miss some work after they come back. You know, kids get sick, parents get sick, stuff happens, and you want to be able to allow them to have some paid time off when they return from an unpaid leave. But make sure that you set it at a reasonable amount. Otherwise, tell them they have to use all of their paid leave up to that point. If our employees are working from home now, can we use a lower cost workers' comp code for them to determine our workers' comp insurance costs? I would check with your workers' compensation provider on that. That is a little outside of my area of expertise, but your workers' comp provider will definitely be able to answer that question for you. You would think the answer would be yes, but you never know. So looks like those are all of the questions. So I'd like to thank you all for joining today. And just, to reiterate, it's really important to stay aware of what is going on in your state. There is a website that I use 90% of the time to answer my questions. It is NOLO, NOLO.com. So if you're ever researching paid sick leave in Washington and you see the NOLO.com pop up, I click, that's the first thing I look at. They just have a really comprehensive website that addresses a number of these HR types of things that I tend to need to know about. So, all right. Well, thank you so much. I appreciate your time, and I hope you all are staying healthy and safe out there.
All right. Thank you, Lori. Thank you to our participants, and we hope you have a great day.